A severe social rejection, peer exclusion, or a devastating breakup registers as a genuine, localized physical ache in the body. We experience this overlap because our modern social lives are being processed by vestigial biological hardware. The human brain evolved to ensure survival in a physically hostile prehistoric environment, and it relies on ancient circuitry to assess modern threats. Look at these clinical brain scans. They highlight the dorsal anterior cingulate cortex and anterior insula. Historically, these regions processed physical tissue damage, but during acute social exclusion, those exact same regions light up. The brain registers a social slight exactly like a broken bone. Mammalian offspring are born vulnerable, relying entirely on the pack to survive. To an early hominid, social isolation meant certain death. Rather than building an entirely new alarm system for social threats, evolution simply repurposed the existing, highly effective physical pain matrix. This ancient hardware also coordinates our most aggressive defensive reactions through the limbic system. At the center of this survival network is the amygdala, the trigger point for what researchers call the amygdala hijack. This is the precise fraction of a second when ancient primal instincts detect an overwhelming threat and seize control of the nervous system. This diagram outlines the brain's two distinct operating states. On the left is the calm state, where the higher cortex is active. On the right is the hijacked state, where the amygdala disables that higher cortex to take absolute command. The amygdala instantly triggers the release of cortisol and adrenaline. The heart rate spikes, pupils dilate, airways expand to take in oxygen, and blood sugar floods the system for explosive energy. This chemical cascade actively routes sensory information straight to the amygdala, completely bypassing the prefrontal cortex. The individual is temporarily stripped of logical reasoning, impulse control, and the ability to calculate consequences. If you need to dive out of the way of an oncoming speeding car, this bypass keeps you alive. But if you are navigating a tense conversation with a coworker, it causes you to freeze, panic, or lash out. An intense emotional overreaction often feels like a humiliating personal failure. Biologically, it is the brain flawlessly executing a deeply necessary but historically outdated survival program. To understand how we manage these primal biological instincts, we look to the structural model of the psyche, formalized by Sigmund Freud. This blueprint maps the psychological software layered over our biology. At the foundation is the id. It is entirely unconscious, demanding immediate gratification for primitive urges, and it serves as the psychological voice of the amygdala's raw emotional output. Pressing down from the top is the superego. This is the internalized moral compass, representing ethical standards, parental demands, and rigid social rules. Caught in the middle is the ego. It is the conscious, rational self, attempting to satisfy the id without violating the punishing constraints of the superego. Normal human psychology is not a state of peace. It is a continuous, precarious balance of intrapsychic conflict, managing the tension between ancient survival urges and the demands of modern civilization. When the tension between these opposing forces becomes unbearable, the ego faces a potential psychological crash. To protect itself, it deploys unconscious tools, categorized by Anna Freud as defense mechanisms. Immature mechanisms like denial and avoidance involve the mind actively dismissing external reality to prevent an emotional overload. This buys the emotional system time to pace its processing of a traumatic event. If the event cannot be denied, the ego might use repression to quarantine the traumatic memory outside of conscious awareness, or it might use isolation of affect, severing emotional pain from the memory, allowing a person to recall a horrific event with zero emotional response. In extreme cases, the mind resorts to conversion, or somatization. An intolerable psychological conflict is translated directly into a physical neurological symptom. A student might experience temporary blindness or severe migraines during an anxiety-provoking exam, despite zero organic tissue damage. Self-sabotaging behaviors, unexplainable physical pain, or suddenly forgetting crucial details appear pathological from the outside. Internally, they are the mind's desperate, misguided attempts to maintain its own structural integrity under pressure. But what happens when the structural boundaries fail completely? In antisocial personality disorder, the moral constraints of the superego are entirely absent or critically broken. This matrix differentiates the two primary classifications of the disorder. Psychopathy is highly biological, a hardware deficiency present from birth. Because psychopaths possess a neurological lack of empathy, their behavior is calculated, cold, and highly controlled, allowing them to easily mimic emotion and maintain a mask of normal social integration. Sociopathy, conversely, is an environmentally acquired condition. It is created by severe trauma or abuse that corrupts the psychological software during development. Sociopaths retain a limited capacity for emotion, which makes their behavior erratic, impulsive, and reactive, leading to an inability to maintain stable social roles. Both conditions result in a dangerous disregard for the rights of others, but one is an inherent hardware absence, while the other is the tragic result of software corrupted by external trauma. We see a different kind of systemic shock during the process of bereavement. Profound loss inflicts massive physical and psychological damage, forcing the ego to rapidly recalibrate to a world that no longer makes sense. This visualization of the Kubler-Ross change curve maps the emotional response to that shock. Denial, anger, bargaining, depression, and acceptance do not operate as a strict linear checklist. They are an oscillating framework the ego uses to digest an overwhelming reality in survivable pieces. Building on that foundation, David Kessler introduced a sixth stage, finding meaning. It is the active, deliberate process of integrating the loss into the survivor's ongoing life, utilizing the memory of the deceased to build a constructive path forward. Healthy grieving involves the strenuous process of rewriting the mind's operating system to permanently integrate the trauma into a new identity. When the mental operating system begins to fail under the weight of trauma or biological stress, clinical science relies on two distinct methods of repair: psychiatric medication and psychotherapy. Psychiatric medication targets the biological hardware. It intervenes at the chemical level, lowering the amygdala's alarm bells, regulating stress hormones, and adjusting neurochemical balances so the patient can establish enough baseline function to navigate daily life. Psychotherapy targets the software. It forces the conscious ego to identify and dismantle destructive defense mechanisms, process repressed memories, and consciously rebuild the psychological scaffolding that trauma destroyed. The most resilient clinical outcomes occur when medication provides the necessary biological stability, creating a safe environment for therapy to successfully rewrite the psychological code. Even with a healthy baseline, modern life constantly triggers our primal threat detection. To prevent the amygdala hijack in real time, clinical psychology utilizes mindfulness and acceptance and commitment therapy, or ACT, as manual overrides. ACT trains the individual to separate from the reactive, excuse-generating thinking self. By activating the prefrontal cortex, a person learns to observe uncomfortable thoughts, like fear or anger, without judging them or immediately acting on them. Looking at this data from the World Happiness Report, it becomes clear why this matters. Subjective well-being correlates with clarifying your core values, like community, family, and meaningful health, and pursuing them despite the obstacles. A resilient mind accepts the discomfort of existence and observes its own false alarms, using the rational ego to take deliberate, accountable action toward a meaningful life.